Governor, your first question comes from Andrew Siff at WNBC. Andrew, your line is now open. Please unmute your microphone.
Governor, how are you? Good afternoon to everyone on the call. Today, Mayor de Blasio said that the city is going to run out of vaccine next week. And he implied that that would be at all the vaccine distribution sites in the city. What can be done between now and next week to prevent that from happening? And as a secondary concern, how worried should people be that they're going to get their first shot but won't be able to get their second shot because the vaccine won't be there?
Okay, let me reverse the order, Andrew. One, you should not be worried about getting the first dosage and then you won't get the second dosage. As I just mentioned, and as we have told the distributors 986 times, as I told them myself on the webinar, as the law says, as the policy says, if the facility gives you the first vaccine, wherever you go for the first vaccine, they have to schedule you for your second dosage, and you go back to that same place for that second dosage. We will make sure, when we do a distribution, we make sure we have the second dose for whoever got the first dose. So Andrew Siff goes to Javits Center to get the first dose. 3 weeks later, you go back to Javits Center. They will have a second dose for you. Don't worry about that. On the second issue, the city running out of supply, they may be some places, I don't know exactly what the mayor was talking about, but some places are working through past supply. So if you look at, let's go to the, do me a favor, pull up the slide for New York City allocations. Many New York City facilities have allocation unused. When we talk about New York City, Andrew, the mayor runs the H&H hospitals and the Department of Health. I think there are 11 H&H hospitals and the Department of Health. You then have about 90 private hospitals. And then you have pharmacies, and then you have ambulatory centers, right? The mayor runs the Health and Hospitals Corporation, H&H, and the City Department of Health. So I think he's talking about that. The private hospitals run privately, and the pharmacies run privately. The New York City, those are the hospitals that by definition are going to have a backlog of unused inventory. And so New York City Department of Health distributed 33% of their allocation. That means they have 70%. So I'm assuming they're talking about working through the backlog. Next week, there will be additional allocations, but less, because the state gets less. New York City, as a region, gets a proportionate share every week, but their proportionate share goes down if the overall state allocation goes down. And we then allocate it among distribution mechanisms in New York City. Private hospitals, you see the hospitals who get it, right? So private hospitals get it, some pharmacies get it, some ambulatory centers get it, New York City Department of Health gets some, and then the H&H hospitals, among other hospitals. So New York City will get more. New York City as a region will get more next week. It will be less because the overall allocation is less. But many of the places in New York City are working through past allocations. That's That's the only way I can explain it. And that's true in many places across the state. They've been getting for about 4 or 5 weeks, right? Many of them are still working through past allocations. What's going to happen very quickly is they're going to work through the past allocation, and then they're going to be getting very little going forward compared to the need. That's the floodgate in the need. What you can't get past mathematically is 7 million people chasing 250,000 doses. That is the mathematical problem that you can't solve. That's the mathematical problem that the federal government created. We're going to make it open to 75 plus. We're going to make it open to 65 plus. And don't worry, we'll increase the supply because we're going to send you the second dose. Not true. They had already sent the second dosages. We had been receiving second dosages all along. That's how we're doing second dosages. And for some inexplicable reason, not only did the 300 not go up, it went down to 250. Next question, operator. Do you want to add something, Melissa?
Yeah, and just for clarity's sake, so when the governor says we're getting 250,000 for next week, that's 250,000 first dosages. So when you see the fluctuation of the incoming from the federal government, people who have already received their first shot should not be concerned that that impacts their second shot, because the second shot is in a separate allocation that isn't counted in the weekly incoming allocation that's set aside for that person.
Your next question comes from Stacy Sager at WABC. Stacy, your line is open. Please unmute your microphone.
Hi, Governor. Stacy Sager. We're looking into how this unpublished scheduling link was shared without authorization. We've been hearing from so many people at Stony Brook that thought they had appointments, people with pre-existing conditions who are elderly. They're very worried, and they want to hear from you on how this could happen.
Yeah, well, first, Stacy, it's not the first time it happened, right? There's been similar cases. I was reading about a case in New York City today where somehow they put out a link or notification that there was going to be a vaccination site, and people swarmed to the site. But let me ask Melissa, who has more information than I do.
Sure. So yesterday, late in the day, we became aware of the fact that there were unpublished links that were set to go live this morning for certain sites that had not been brought online yet, that and I don't want to speculate on what it is because it's since been referred to the Inspector General's office, so they'll do their review, but the hypothesis is either it was hacked or there was someone who leaked the link. And we understand the frustration if somebody got the link not knowing that there was devious intent behind how it got out. However, as the governor said, there's 7 million people vying for 250,000 shots, and the system to sign up has to be fair. And so we felt that it was important that we reset those appointments, and when they went online this morning to the public, everyone had the same fair shot at getting those appointments because, as we know, they're so incredibly limited. So there is an investigation ongoing. When the results of that investigation are complete, we will tell the public exactly what we know, but that's how we got here.
And you know, Stacy, it's going to be a bigger problem than that, unfortunately. When you have 7 million people and you have this kind of demand, and when you say it's a limited supply, you create a tension and an anxiety in and of itself. You're going to have fraud. You're going to have a black market. I've contacted the Attorney General's office and asked her, Attorney General Tish James, please watch out for possible fraud. You'll see people on the internet saying, I'll sell you the vaccine. Some of it will be fraudulent, but some vaccine along the way, some vials, these are tiny vials, right? A vial has 10, 11 doses in it. You'll see some vials stolen. I would wager it because they are valuable. So you're going to see hacking, fraud, theft. It's almost predictable, as ugly and as unfortunate as it is. Next question. Operator?
Governor, you now have Zach Fink from New York One. Zach, your line is open. Please unmute your microphone.
Mr. Fink, unmute. First time I ever had to tell you that.
Stand by. We are having technical difficulties.
Oh. Figured it was our side as opposed to Mr. Fink's side.
Governor, your next question comes from Juliet Papa. Juliet, your line is now open. Please unmute your microphone.
Hey, good afternoon, Governor. How are you?
How are you, Juliet? Good to hear your voice.
Good, thank you. So I was wondering, given that you have limited access to supply, is there any way you can, negotiate your own supply from the pharmaceutical companies? Is that feasible, doable, legal?
See, Juliet, New Yorkers think the same. I have queried the same. Pfizer is a New York company, but the answer is no. The federal government controls all the purchasing, all the production, and all the allocation. And the federal government's allocation is proportionate to population. But we tried that. You know me, Juliet, I've tried everything. But it's a good idea, but it didn't work. Next question, operator.
Governor, your next question comes from Bart Jones at Newsday. Bart, your line is now open. Please unmute your microphone.
Hi, Governor. Could you just respond a little bit? There are a lot of complaints out there about the state website for signing up for the vaccinations. It seems to be quite a bit of turmoil. A lot of people are saying it's not really working very well. Can you respond to that? And also, the CDC numbers are saying that you guys have more than 1 million unused vaccines. If you go on their website this morning, they're talking about 1.9 million delivered to New York or sent to New York, and only about 700,000 used. So that leaves about 1.2 million unused. I know you just said this morning you've had 74%, put in arms. Can you folks explain or clarify that? And finally, on the Stony Brook situation, do we know how many people had their appointments canceled from that Stony Brook situation?
Okay. I'll ask Melissa to talk about Stony Brook, Gareth to talk about the numbers. But remember the Stony Brook situation, Bart, that was a fraud, right? There were people in New York City who showed up because there was some fraud that there was going to be a vaccination site. Consumers have to beware. People will offer to sell you the vaccine. People will say, come to my office, I'll give you the vaccine. People have to beware. That was just a fraud. On the CDC numbers, look, I take everything nowadays the CDC says recently with a grain of salt, but I'll ask Gareth to talk about that. On the state website, let's understand the facts. The state doesn't do distribution. We set up some retail distribution. We're setting up some mass vaccination sites, but they're really to catch overflow more than anything else. The distribution is done, as I just showed you on the screen, the county health department, hospitals, ambulatory centers, pharmacies. The state website connected people with pharmacies, county health department, et cetera, in their area. What happened is they're fully booked because you have so little supply for so many people. So if you go to the CVS website, punch in your local area, you'll find your local CVS, and chances are they're going to say, we're not taking any more appointments. Same thing for all the other drugstores, and same thing for the other ambulatory centers that are there. So you can go to a website. Our state website was really an assemblage of available websites. But yeah, it said CVS full, Walgreens full, Rite Aid full, Doctors Annex full, because they were full. And the state itself doesn't do retail distributions, right? Nassau, Suffolk, we're going to open up a couple of mass distribution sites now, Jones Beach. But really, it's the pharmacies, the counties, it's the doctor's offices. And our website was just an assemblage of those. It referred you to those websites, and those websites said, we're booked. Melissa?
Yeah, also on the website situation, so when we first launched the website in anticipation of servicing 1A, which quickly became 1B, which quickly became 1B+, the idea had been that it could serve as sort of a one-stop shop into all of these other places that the state was allocating vaccines to: pharmacies, local health departments, hospitals. What ended up happening was all of a sudden we went from a manageable universe to 7.1 million instantly. People that were going onto the site were also then going onto the pharmacy sites, were also going onto local government sites. The crush of all of that pass-through was causing the servers to go down. What we've done since Monday, since Tuesday, was we've made the site a lot more simple and clear. People should call their local pharmacies, people should call their local health departments, people should call their local hospitals and see if they have availability to make an appointment or go on those websites. And it's now removed from the state site. So you remove all of that additional traffic from the state site, which will help the state site function better. The larger issue, as the governor articulated, is that you have 7 million people trying to get 200,000 appointments. And at this point, several of the state locations that are booking as far as 14 weeks out already booked. And the state website is going to be updating every 3 hours to say, SUNY Albany booked for the next 14 weeks. Because I understand part of this is general frustration with people who are trying to get through on the site, who are trying to book appointments for family members, and it feels like you're banging your head against the wall. So we want to make sure the communication is as clear as it possibly can be, while we're also trying to deal with the issues of the general website and the influx of people who are very eager to get the vaccine. On the number of people at Stony Brook, it was approximately 20,000 people that had signed up for appointments through Stony Brook. And just to put that into context, Jones Beach, which is completely sold out, which went up online appropriately, which no one got appointments to early, had 55,200 appointments on the website. And those filled up like that in 2 days. So what happened with Stony Brook is you're basically saying half the capacity of Stony Brook would have been gone before any real member of the public who did not have this fraudulent link was able to sign up to begin with. And that was where the system was really unfair, and we needed to address that issue.
Bart, just to stay with this for 1 second. We have about 1,000, we have over 1,000 distributors statewide. Pharmacies, county health department, hospitals, et cetera. 1,000, over 1,000. The state website is only a collector. Of those 1,000, state doesn't really operate any. We're starting some mass vaccination sites like Jones Beach, but there's only like 10 of them or something. Our website was the collector of the 1,000. So punch in your address and it'll tell you the distributors in your area. But when you then went to the distributors in your area, they were all booked. So it was frustrating. So we got out of the collector business, and we'll tell you who. It's pharmacies, doctors, hospitals, local health department. And then for the sites that we are running ourselves, how many are there now, Kelly?
We have 5 operational right now. We are opening 8 additional statewide starting next week. And a week after that, we will be adding to it. We'll have a total of 20 state sites in every region of the state.
So our 13 state-operated mass sites can be scheduled through the state site. Otherwise, people have to go to the county department, city health department, or the local pharmacies. Gareth, you want to speak about the numbers, CDC?
Sure, there's no discrepancy here. The CDC number on its website is a global allocation number to New York. That is not necessarily what has been delivered to New York so far. It also includes the long-term care facility programs, which are federally run through the pharmacies. And in that is, once New York opts in, over the period of weeks that program runs, the full amount shows up as allocated, even though much of that has not been delivered yet and will only be closer to the date. New York, the numbers that we put up today, we put up every day. We are not putting in there the doses that are continuing to come in through this week. So we've received through week 1 through 4, 1.1 million doses. That's what's being distributed and put in people's arms right now. Of that 1.1, as the numbers were shown on the screen, 730,000 doses have been administered. And of the second doses, we receive exactly the same number of doses 3 weeks later for Pfizer and then 4 weeks later for Moderna. The 170,000 second doses have been delivered. But if you break this out even, if you take out the long-term care facilities program, which is a federally run program, New York's got about 844,000 doses delivered to date. Of that, 623,000 have been administered. That's 74%. So that was the number you saw on the slide. And you saw the regional breakdown of that as well. For example, closer to 60% in New York City. Outside of New York City, closer to 86%. It varies by region. But the administration numbers show that based on what we have on hand so far, New York is doing very well.
Operator, let's take one more question.
Governor, you now have Zach Fink from New York One. Zach, your line is open. Please unmute your microphone.
Hey, Governor, I think we found a solution here, although I'm not going to be able to hear you. But I did want to ask, number one, we're hearing that the federal government's not being able to come through with this in terms of the supply. Is there a reason? I mean, is it federal incompetence? And I also wanted to get your reaction to the AG's lawsuit against the NYPD. Do you feel a federal monitor should be imposed on the department? Is that where we're at?
Yeah. Let's do both. One, Zach, I think, I am not a big fan of the current federal administration. Shocker, as that statement may be. I think what they did was politically motivated. We'll open 1A, we'll open 1B, we'll open 65 plus, we'll open people with comorbidities. Don't worry, we'll address the supply. So on the way out the door, they could say, we made it eligible to everyone, and we increased supply. Except they didn't. And even what they said they would do was implausible. We'll accelerate the second dosages. They already were accelerating the second dosages. They gave us the second dosages as soon as our people were eligible for second dosages. They did not secure any additional supply. They didn't buy more Pfizer or buy more Moderna or approve Johnson & Johnson or approve Oxford AstraZeneca. They didn't do anything to increase the supply. They had the supply they had, and that was it. So I think it was all politics. We're going to open it up to everyone. Nobody should be treated differently. Forget the prioritization. We open it up to everyone. Pat me on the back. But there's no supply. And by the way, I leave next week. So that's where we are. On the Attorney General's investigation, the findings are very troubling and disturbing. As you know, I'm a former Attorney General. I dealt with many issues with the NYPD. I asked the Attorney General for the investigation after seeing the video of the protests and some of the actions and the uproar from many legal advocates in New York City. I applaud the Attorney General for the thoroughness of her action, and I applaud the Attorney General for her courage. You know, it's hard to speak truth to power. It's hard to speak truth to the NYPD. It's hard to speak truth to the mayor of the city of New York. But she did. And that's what doing justice is all about. And that's what leadership is all about. So I applaud her personally. But it is troubling on a fundamental level. And what's most troubling about it is it's nothing new. People have been complaining about this for years. The kettling policy had been discussed for years. The people were told that it was over. And for years, people were saying it wasn't over. And there were lawsuits, and there were videos. So in some ways, what's most disturbing to me is the fact that it only confirmed the worst information that people assumed, that they were being lied to. And I think the people of the city deserve an apology, number one. I think this is a very complicated, tense situation now that exists between the NYPD and the community. I think the tension is destructive on everyone. You have a shooting crisis in New York City. You have a COVID crisis, and you have a crisis in the increase in crime and shootings and the lack of solving these shootings, the tensions between the community and the police, the lack of trust, and the tensions for the police officer. You know, you're a police officer, you're following the policy. You're not a policy maker. City Hall makes policy. The commissioner makes policy. You don't make policy. And to now find out that these policies were coming from the top and these policies were what was creating the tension, there's a lot of work to do. But I think the people of the city deserve an apology. I think we have to work on now moving forward. The monitor is really the only thing the Attorney General can ask for legally. The Attorney General legally can't say who should be replaced. So the legal option for the Attorney General is a monitor. I think we have a train coming down the track that is going to get there first, actually. By April 1, New York City has to submit a new public safety plan. April 1 is April 1. And Zach, I understand deadlines in New York City. They're supposed to be out of Pier 76 by January 1. They're still not out. April 1 is April 1 because April 1 is the day the budget is signed. And they will not be in the budget if they don't have a passed new police plan. And that is not going to be a deadline that can be blown. Because as you know, when the budget is signed, the budget is signed. And I said months ago to every locality, we have 500 localities with a police department. I said to them months ago, form a collaborative, put everyone around the table, let everyone speak, let everyone vent, discuss the real issues. I went through them in the state of the state. What should the use of force policy be? A lot of important questions. Communities all across the state are doing it. They're doing it. They're making great progress. And by the way, it's a positive exercise. It's not easy because you have tensions, and both sides has to say their piece. Community is going to talk about use of force and brutality and abuse and perception of racism. The police are going to say, how do you expect me to do my job if I can't even touch someone? And how can I do that without touching them above the waist when they're coming at me with a knife or a gun? You have to have that conversation. But they have to have a plan in by April 1. That's like 9 weeks. It has to be passed by the city council. I don't see New York City theoretically has the police department in charge of the reform plan, which, by the way, doesn't make any sense to me. There is no agency that is going to reform itself, right? The agency is doing what it's doing because it believes it's doing the right thing. How should you change your reporting style, Zach Fink, to be a better reporter? I know your answer. I'm the best reporter I can be. Everything I do is right. Zach Fink, reform Zach Fink's reporting style. You can't. You can't ask an agency to reform itself. Well, there's an advisory board. But there's 9 weeks. You have mayoral candidates who are now talking about wanting to run New York City. How would you reform the police department? You have all sorts of criminal justice reform groups. How would you reform the police department? You have people within the police department who have ideas on reform. And the city council has to pass this. And it's 9 weeks. And that deadline is not going to be waived. That is not going to happen. Government has to perform. And this is critical. And it's not just critical because of April 1. It's critical because the increasing crime is compounding the problems in New York City. Yes, you have COVID. Yes, you have increasing homelessness. Yes, you have people who are concerned about the long-term economic viability. And you have increasing crime. If you look at the economic cycles, you are not going to have a strong economy if you don't get the crime issue under control. I'm old enough to remember, and I'm a native New Yorker. Not that we don't love people who move in, but I was born here, I grew up here, I remember what it was like. And the rate of crime, the strength of the economy, there's a parallel. And we have some problems we can't figure out. We can't cure COVID yet because we can't produce the vaccine. Fighting crime, restoring the relationship with the community, that we know how to do. And use this as an opportunity. It was already clear that you had to reform the relationship between the police and the community. It was already clear that this was not working. You're not even using the NYPD, right? Everything is the sheriff's department now. There's only 150 sheriffs. I never heard of the sheriffs being used to do these types of activities before. So clearly there was a problem. You put the lawsuit on top of this, then for sure you have to move forward and get something done. And I think April probably comes before the monitor. I don't think the monitor could be a negative. They've had monitors before, but it doesn't substitute for political accountability. This is a political matter and political accountability. And the council has to pass a plan. And the council has to pass a plan by April 1. And I haven't even heard a discussion about it. And they have to have a conversation with the community. And that's going to be some conversation. and it should be. Thank you, guys.